Good morning, everybody. Welcome to the Medicare Cafe. We're jumping on just a few minutes early just to do the pre-chat, but honestly, during AEP, it is all kind of pre-chat.
Yeah, it is all kind
There's
of pre-chat.
not much of a difference because we're doing the What's Brewing series. So welcome. My name is Olivia Richardson.
And I'm Sadie Palmer.
Did you forget?
I did.
I was just
Sure
at
did.
some point I was supposed to do something. What a wild AEP it's been so far. It's just been, I can think of, again, What's Brewing? What's Brewing is we just kind of give you the weekly updates, what you need to know, what other agents are saying, what the carrier is saying, and what the clients are seeing. Ooh, that sounded really smooth. You should copy and paste that,
good.
right?
That was good.
Never again. But so that's what we're gonna be talking about today. But it's been I've been literally shut away in my office all day, just replying emails, trying to get things done, writing reports. It's been just a wild day.
Yeah, on my end, because I'm not agent facing, I almost said client facing, not agent facing. I would love for you guys to put in the chat some of the crazy stuff that it's been happening to you, just because everything I hear is kind of secondhand. So I would love to know what's brewing on your guys' end.
What's brewing on your end? Yeah. Now, if you do want to interact with us, as always, that is my cell phone number. You can text it at any time, and I will make sure I always try to respond same day. But yeah, feel free to text me if you're like, no, it's not. Even if you're watching the recorded version of this, still shoot me a text. Or if you are watching us live, you can also make sure to use our live chat feature and talk to us on there as well. Again, we did talk about how we did have to turn on moderating for that because some of you guys be wilding on a Tuesday morning. And you know what? I support it. Others maybe not so much. So calm down a little bit. I'm trying to think of anything. I had something I wanted to talk about on the pre-chat just for a brief minute, but I can't think about what it was this morning so far. So if you want to, we can go ahead. It's a minute till. I got plenty of updates this week.
Yeah, let's jump in.
Plenty of updates. Let me ask you this. Let's play a game. Let's play a joke. It's kind of a joke, but it's more a game.
Okay.
What is the worst thing CMS could do to clients right now during AEP? There's a lot.
Oh, no, yeah.
What's something that would cause, let me say this, what's something that could cause mass confusion during AEP?
I have an answer, but I don't think that this is going to be the answer.
Okay.
For game's sake,
yeah,
they say everyone's required. We're rolling out new Medicare ID cards.
Guess what happened?
No,
new Medicare ID cards. Yes, man.
Oh my gosh, that was a total joke.
New Medicare ID cards because of the July 8th. What happened with going on with the Medicare? What am I trying to say? They got hacked.
I need you guys to know that was a total guess. That was totally me being like, this isn't a thing.
Yes. So
wow.
New Medicare numbers are being issued due to the data breach back last May. All these decisions and all the things happened in July 8th. So what's causing that, again, everybody's getting new cards, everybody gets new Medicare numbers.
No way.
Applications are pending and getting denied due to incorrect Medicare number because they are using the old Medicare number, not the new one.
Wow.
So make sure that you are asking your clients if they received a card in the mail on top of voting, on top of the election, on top of Medicare, on top of other advertising. They're going to be getting a new Medicare card in the mail. So make sure you're asking that if they receive that or not, because applications are pending for the wrong Medicare number, which is insane. So if you're like, what the heck? What the heck are you talking about? Last May, we found out that Medicare did have a data breach due to a third-party user that they have called WPS. WPS is responsible for one of the vendors responsible for helping handle Part A and Part B claims. They had a data breach due to a software they were using called Move It and left thousands of individuals exposed and their information, including names, social security number, date of birth, all of that on the dark web. So new Medicare numbers are being issued during AEP. It will affect you. It is likely that you will have some apps pending. Make sure you're asking the right question.
So how long has it been since they I don't know where I've been, but
it was so part of it too, if you remember, whenever the dual special needs, the ability to check that all shut down, nobody can confirm.
Yes,
that's part of that. Because of those data breaches.
So have they been rolling out new Medicare
No, they
numbers
just
since
started.
Okay, so not crazy.
Not crazy. No, they just started issuing out those Medicare numbers at literally the worst.
Wow.
I mean, it's pending out.
Yeah, but also, if there's stuff floating out on the dark web, it's
it's all scary. There's not there's not a piece of good information that comes from it.
Yeah,
Yeah, it's all
totally.
bad. It's all bad.
The dark web is bad, and because I
You
went down a rabbit hole, not on the dark web.
Yeah,
Let me
you
just
should
get that straight.
clarify.
On the regular internet, because I did not understand what the dark web was.
Can you tell me? You told me this story, and it's my favorite thing you found on the dark web, and it's no.
Yes, okay.
You really quick.
So
time out from the bad news. Let's talk about gnoming for a second.
Also, I want to say I did not find this on the dark web. I've never been on the dark web, okay? That was part of my questions. What is the dark web? How do you get there?
Here comes the FBI.
But I watched this TikTok of this guy talking about things on the dark web. I thought it was all organs and whatnot, but it's not. There's this service that he talked about that is called gnoming, and you can hire someone on the dark web to go and put gnomes and then move gnomes around in someone's yard. And that sounds like, okay, that's one thing. But because it's on the dark web, they do really crazy stuff. And so you can pay them money to have them move around this random gnome that shows up in their house. And they even say, like, the guy's like, oh, like, security systems, like, don't matter. Like, that's part of the service and whatnot, which is why it's on the dark web and not regular.
Mess with people and just be like, you're just going to start showing up gnomes. And there's like, you can put like hundreds of gnomes in a house, or just one gnome that you just move within the house and they think their house is haunted gnome.
Yeah.
So anyways, Medicare got hacked. Your clients are getting a new Medicare center, or Medicare numbers. It's pending apps. Make sure your clients are in the know about that situation.
Yeah, that's
what
crazy.
A bad case scenario. Some other updates I have for you guys. We're getting a ton of information about SARs. We'll be talking about SARs a lot during AEP. I don't know that this is record breaking because service area reductions on Medicare Advantage plans were pretty common 10 years ago, 15 years ago. It wasn't something we were not used to seeing. The market fluctuated. We just, in the past 5 years, haven't seen a ton of SARs. Obviously, this year, huge SARs and a ton of them. So just making sure you as an agent understand your client's rights when it comes to a service area reduction. Reminder, a service area reduction happens whenever a person, their Medicare Advantage plan is not mapping, aka crosswalking, means that their plan is the Medicare Advantage plan is not automatically moving them to a new Medicare Advantage plan. And come January 1, they're without coverage because that plan is leaving that service area. It's called a service area reduction. So just keep in mind what your client's rights are for that. They can obviously choose any Medicare Advantage plan or prescription drug plan that they want during AEP for a January 1st effective date. But if they don't choose anything come January 1, they're going to be without coverage except for original Medicare. Also, they do have the right to do a guarantee issue Medicare supplement that will greatly affect your commissions. Commissions will be sliced, diced. You'll hardly see them. So just keep that in mind. And usually GI business does not count for any like Medicare supplement contest or extra bonuses or things like that. Plan In is a great option for your clients who want to go back onto a Medicare supplement because it is still underwritten. The rate increases are much safer, much less, and it's a great option for your clients. So keep that in mind. Last thing I'll say about SARs do have the ability to really extend your AEP if you're really worried about not seeing all your clients, especially like Kansas City, Washington, a lot of places in California. A massive amount of SARs.
Yeah.
SARs get a separate election period starting December 8th, ending February 28th. So if you want to make sure, like maybe you wait to see your SAR clients until after AEP, so you have another 22 days to do that, you absolutely can before January 1st.
Yeah, this AEP, obviously a lot of it like leading up to it, we've talking about how like time is always so precious during AEP, but this AEP specifically, like prioritizing your client list and everything like that. And so there's been a few ways that have kind of popped up that have like really shown. I know that some of our agents, what they do, I don't really know if this is suggested or not, but they, also tell people, hey, we technically can meet after AEP because of this thing called open enrollment, stuff like that. And then SARs. So if you are worried about meeting with everybody, again, you might have already prioritized your client list, but throughout AEP, you might be changing some of that too. People are moving down, people are moving up. SARs, now that we know more information about them, now we know that we have that extended period of time. So hopefully that's helping some people out a little bit. But.
For sure. I think that's a great point. And also keep in mind, Medicare Center does help you prioritize your clients. Now, it is going to prioritize those clients' experience they are, number one.
Oh, sick.
Because it does automatically. You can filter your clients based on what plan they have, the medications they're on,
Yeah.
and they filter by 3 priorities. Priority 1 is they don't have coverage in January,
Sure.
right? Because they're obviously the priority because they're not going to have coverage. But
Right.
to just keep that in mind, if you're using Medicare Center, you do have the ability to have that pre-sorted for you.
Cool.
Now, I do have a question from somebody who says a client who, oh yeah, and if you have questions, again, these are just updates, so let us know your questions. A client who has diabetes too, his doctor suggested Ozempic in North Carolina. He has several options and kind of was listing those out. But if he stops Ozempic, will he save much more on WellCare? Blah, 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 blah. How do I know how long he's going to take Ozempic and what the plan would be would I suggest? Thank you for the question. What a hard question, right? Because it's like if you don't take that Ozempic, then that completely changes. Ozempic is such a hot button topic this year, and it's on everybody's PDP list, and it is for sure making a change in like what do I do? Like because if they're not on this because it's meant to be like a temporary medication. In a lot of cases, not all cases, but in a lot of them, the only thing that I can really recommend is running both options for your clients and just making sure they truly understand. If you're going to continue to take this is the plan. And it's going to cost you more because Ozempic is expensive, but this is what you can expect to do if you're going to have that medication for this long. And encourage them to talk to their doctor. What is their doctor's plan for that medication? Yeah. And then say, this is what it looks like if you're not going to account for Ozempic in that. And Ozempic does, again, every single pharmaceutical company has to have programs and they have to have coupons available for individuals who may struggle paying for that medication. Or look at something like CleverRx. CleverRx, you cannot use both. If you're looking like this one medication really changes what drug plan they're on, really changes the cost, and it may just be temporary. Check out CleverRx. Take the Ozempic off of that PDP comparison and see what coupons and what programs you can find for that particular medication. It may be cheaper to go that route for them based on that year.
Yeah, I have a feeling in the next like couple years, we'll be seeing lots of changes and lots of things focused around Ozempic because it is so, and it's even kind of like a fad drug right now, dare I say.
I mean, it's like advertised everywhere. Yes. Not for diabetes, but for all obviously the weight loss reasons. Right. And which isn't going to be covered by a Part D plan if it's not for diabetes.
Correct, exactly. And that's like another thing because a lot of people are using it for lots of different things. The original use is going to make a difference on whether you qualify it for it or not. But then the thing about like how long are they going to be on it and everything like that. Obviously every drug people have to do kind of like a trial period to see like how it works out for them. True. But because Ozempic is being so marketed, so people are asking about it, doctors are prescribing it, and I know that a lot of people that end up like having to get off of it really quick because it messes up a lot of different stuff. So it's I think we'll be getting a lot more questions specifically around that, and then like even the generic versions of it and like all the semaglutides and all that sort of stuff.
But it's so interesting all the reasons people are prescribing Ozempic because it's not just weight loss and it's not just diabetes. Apparently it's a really great treatment for high cholesterol and high blood pressure.
I mean, that makes sense because it like suppresses your appetite.
I suppose so, but okay, I'll give you my mom for an example. My mom is a 5'3" warrior. Okay, she works out. She could bench press Buicks. I'm not even joking. This woman is wildly more athletic than I will ever have the opportunity to be. She has really high cholesterol. Her weight is super in check. She works out, like I said, but she has high cholesterol. Always has. It's genetic for her.
Yes,
she's on. Her doctor has prescribing her Ozempic. For that, even though she's very healthy weight, no diabetes, but they said that's the quickest way to kind of keep, so I think this question's going to come up a lot.
I think so too.
We saw it a lot whenever, what's it called? Not COVID, COPD medication started getting really overly prescribed for individuals who had, I'm not going to say overly prescribed. Who am I to judge? I'm not a doctor. I don't have a degree in pharmaceutical stuff, but was really prescribed for individuals who had severe allergies or other things that and it was affecting how things are being covered, and it was affecting their ability to get coverage because the companies would just say, oh, you're on COPD medicines, but they didn't have COPD. I imagine we're going to start seeing Ozempic and other related medications treated very similarly.
I agree. Yeah.
Okay, what other updates do I have for you? Terry was asking, how can we check on the new Medicare numbers? Great question, Terry. I don't really have a great answer. The only thing that the carriers want us to tell you as agents is that you just need to ask, have you received mail from Medicare? Have you received a new red, white, and blue card? But like, look how much mail they're getting.
I know. That's what
They're getting. Sears Christmas lists again.
Right.
My mom got a Sears catalog for the Christmas list. I'm like, what is happening? Is 1995 all over again? The election, Medicare in general. So yeah, that's right now what carriers are telling. Thank you, Brian. Appreciate you. Okay, so that's one of the updates. I'm gonna kind of go into a couple common questions we're getting right now on the team. Oh, Brittany texted me because she's the real MVP. So to check on new Medicare numbers, Brittany, again, God's gift to earth. Queen. They are saying to check SSA.gov. So check on Social Security. It's probably either that with probably my SSA or my Medicare.gov, because that actually goes into what their information is. But Brittany says SSA.gov should tell you if they receive new numbers. Probably.
Like a portal situation?
I imagine. Okay. Brittany, tell me. Oh, wonderful, wise Brittany. Summon her. Is it a portal? Or is it just... Anyways.
You could just text her.
Well, she's watching.
Okay.
I feel like the powerful
I'm like, you have the portal right there.
The portal. But she's also watching, so I'm just gonna wait. And if she doesn't text me, I will cry.
Perfect.
Yes, she said yes. It's the portal situation.
Awesome,
ask and you will receive, Sadie.
Yeah.
This is what it's like.
That's nice.
Questions. Here's just some common questions. We're getting the number one question our team says that they're getting from clients. We aren't not client facing. We just do the client facing research for you, the agents. Yes, the client account. Implants. We're seeing a ton of reduction in dental benefits this AEP. So a lot of clients are asking about, I need implants. Where do I need to get that done? Because it's not going to be covered next year. Mm-hmm. We are seeing a few regional carriers cover dental implants, but they are honestly, it seems to be more of the regional ones than the big names are. Few and far in between. So you may consider start talking to your clients about standalone dental plans. You probably haven't had to over the last 5 years because the dental benefits have just been growing and growing. You're going to have to start talking about that now because the plans are just not as rich as they were. So might be looking at offering standalone dental.
Which, I mean, isn't like a huge surprise. We all knew that benefits were going to go down. We all knew that dental was probably going to be the first one to be cut. But it's still,
I mean, and the thing what's hard about that is that Deft Research, this was studied back in 2020, 2019, stated that the number one reason why people shopped Medicare Advantage plans was the dental benefit. So it is really important, but they did suffer a lot of that cut. So, so again, if you're wanting to kind of make sure your clients are shopping for the right reasons, you might want to actually start looking at standalone dental, vision, hearing plans versus just relying solely on what the Medicare are offering. Big and really important for my Medicare supplement people out there, because a lot of your MedSup people are looking at MA plans because of the dental benefits, even though they're being cut right now. Pretty wild.
That's very true. And dental is one of those things that you have to make sure that you're asking people about it. You can't assume that they will talk to you about the dental benefit of it or anything like that, just because, one, people are used to having it. Two, they know last year dental benefits went way up.
Well, crazy.
Yes, exactly. So it's been kind of a flow. So people might not realize that that's being cut as much. And also dental is one of those benefits, kind of like what you were saying, is even if people aren't using it and you're not seeing claims come from the dental aspect of the plan, people are shopping for the dental because they like to have, dental is one of those things that they like to have just in case. So even if they aren't using it, it might still be important to them.
I mean, that when people talk about their insurance with group plan, one of the first things they go to is talking about their dental benefits.
Right.
It is really important. Everybody, wants to keep their teeth, keep their eyes, and be able to hear stuff.
Yeah.
I know we're at 10:16, but you think, and honestly, especially the hearing doesn't get talked about enough. If you look at the depression rates with people who are, the depression correlation and like the health correlation with hearing, we know like the eyes are where you find really serious things faster.
Yeah.
Like the eyes, you can find some really serious heart and diabetic things through your eyes. Obviously people health, hygiene, and being able to eat with the teeth and infections that come with teeth, no one talks about hearing. Hearing, the correlation between hearing capabilities and depression and like health and like your decline of health when you become hard of hearing
Yeah.
is insane, and the loneliness that comes with that. So again, don't overlook the hearing stuff. Even though you can cut some dollars on a plan by just getting standalone dental, not looking at vision or hearing, don't overlook hearing.
Yeah.
We are at 10:17. I have a few more updates, but I'm just gonna like fast list it.
Rapid
fire it. So number one, a huge scam alert right now. A lot of your clients, this is the time of year because it's shopping season that a lot of clients fall victim to being scammed, especially the senior demographic. Way more important now that we have the Medicare number cards coming out, Medicare number being reissued and new cards. And then also because of the election. So making sure that you're really vocal to your clients about scam alerts and trying to make sure your clients on scams. They're at an all-time high right now. Want to let you know just a couple of carrier updates. Tons of Medicare supplement contests and promotions right now, especially for underwritten business. So if you're in the Medicare supplement space, huge opportunities for bonuses, carrier trips, lots of incentives. Make sure you check those out. Aetna is talking about, we all kind of expected Aetna to have a tough year after such a high skyrocketing of cuts and benefits this year. Aetna is saying that in the areas they have SARs, they're actually huge win backs. That a lot of like Aetna's numbers are actually climbing. We're not seeing nearly the drop off as we expected. So don't sleep on your Aetna. I mean, again, it's a lot of I mean, we're surprised to see how much Aetna business we're getting in.
Yeah, absolutely.
Keeping on that train, Devoted, there's relaunched into a ton of new states this year, having a really hot start. Brittany let me know, again, the all and powerful Brittany, that they did see a lot of their markets that Devoted that they were in, that people are kind of leaving them to go somewhere else. But Devoted is being very vocal. They're expecting a wild OEP. And that's not the first carrier I've heard that from. OEP this year, carriers are expecting OEP, especially your local carriers and your carriers who are performance and that are service-based versus name-based, like a Devoted. No one knows Devoted, but they have incredible service. They're expecting some pretty intense OEP now. So good or bad, making sure OEP, we're going to have to be much more worried about protecting our clients than ever before, because I think our carriers are really expecting wild OEP now. And I think last but not least, be aware if you are in a state with a new birthday rule or anniversary rule on your Medicare supplements. There's almost a couple dozen states now who just within the last 5 years got new birthday rule or anniversary guarantee issues for MedSups. Be on the lookout. A lot of carriers are announcing some rollbacks and some commissions. So on that guarantee issue business, if you're not used to that, like we are here in the great state of Missouri, be making sure that you're paying attention to your new commission statements that are coming out, because you're seeing commission cuts on that anniversary and on that birthday rule that's up. Every single week, I think I need to make sure that I have enough updates to fill 10 minutes. And my gosh, and every week I've gone over. There's just a lot going on.
There's a lot going on.
So if you want to continue to get updates from us, we will be doing this every Tuesday at 10 a.m., trying to keep them short and sweet. We did have to make sure we gave the gnoming story today because that's just wild. I love that.
And I kept it shorter than what I could have. I just have to say.
We'll have to do a gnome video.
Yeah.
Maybe we do our own version. Let's go gnome Joanne's house.
Let's go. Yeah.
Done.
Yeah.
Okay, so we'll have an update on the gnoming. But again, appreciate you all so very much. Join us next Tuesday at 10 a.m. Every week throughout AEP, we'll be just doing, hey, what's people talking about? What do the carriers need you to know about? Give you some updates on Medicare as well. Should be seeing premiums coming out soon on Part B and everything like that. So more to come.
Cool.
Awesome.
Thanks, guys.
Until next Tuesday, have fun,
make money,
and give impeccable service. Thanks, y'all.